In the meantime, the ongoing debate of rising prescription drug prices is a hot topic in America, especially as we get closer to the 2020 presidential election. During his recent State of the Union address, President Trump called on Congress to pass bipartisan legislation to reduce the cost of prescription drugs.
Get a bill on my desk and I will sign it into law immediately.
In Maryland, there's a new committee aimed at making prescriptions more affordable. Now, the committee is not expected to submit information to Governor Hogan, though, until 2023, so still 3 years down the road. There are other options out there, including an online option available now that could help you save. Just need to learn more about it. It's called Honeybee Health, an accredited pharmacy online. So we have questions. How does it work? How is it different from other online pharmacies? Joining us now is Dr. Jessica Nuavandi, the co-founder of Honeybee Health. Thanks for coming here today. Before we talk about your particular solution, as you see it, to this problem, when we talk about the president and even the governor of Maryland saying, look, we got to do something, bring something, put it on my desk and I'll sign it. As a whole, do we think the healthcare industry will ever get to a point where we're making it cheaper for people to get their prescriptions?
Yeah, well, first, thanks for having me. I'm really excited to be here. We're just happy that people are getting involved in the conversation. But at Honeybee, what we're saying is that we don't need so many people getting involved in the negotiation of pricing, because generic prescriptions are actually very inexpensive. Patients just never get to see that price.
All right, talk a little bit about your business model then. You had been a pharmacist for a long time in a pharmacy. What made you decide I want to do something different?
I was tired of seeing people walk away from the counter without their prescriptions. You know, close to 50
Because they couldn't afford them?
Because they couldn't afford them. And close to 50 million people in this country walk away not being able to afford them. So at Honeybee, we're an online pharmacy that's giving Americans access to wholesale pricing for generic prescriptions for the first time. This is fair pricing, and we're just urging patients to go to our site, search their medications, compare. Most people in this country have a high deductible health plan and can't even afford their copays. This is cutting all of that out.
So your solution to this problem, the way that you describe it, the way you set up your business model, is essentially for people to skip their insurance altogether. And
Absolutely.
You're saying it's a cheaper option to just come in and buy wholesale from you.
Yes, that's exactly it. We believe that the only people involved in your healthcare should be your doctor, your pharmacy, and yourself.
All right, what's an example of the price differential that you might see if you do a service like your own versus a traditional service?
Sure. So let's take the generic for Crestor, which is a really popular blood pressure medication, or Lipitor. If you go to a retail pharmacy, even with a really good insurance plan, not a high deductible, you're looking at $10 to sometimes $100 copays. At Honeybee Health, it's just $5.
Okay, so that's an example of what could work. The thing I think people need to be aware of, we're just dealing with the generic medications here.
Generic medications, absolutely,
okay.
Which is 9 out of 10 prescriptions in this country.
And we're not quite everywhere in the U.S. yet, but you are in D.C., Maryland, and Virginia.
Absolutely. We're in 40 states, and we should be in all 50 by the end of the year. And we want people to go to this site, use this as a resource, search your medications, and see what we can save you.
Do you think the mainstream industry will change at some point, though? You think they'll either come down to your business model or adjust their prices at some point?
We sure hope so, because we are tired of it. As pharmacists, we are tired of seeing people walk away and not being able to afford what their doctor told them they should take. So
you're not worried if your business model is a success of somebody else coming in and saying, hey, we're going to do the same thing now and cut into your business?
Let's hope that happens. We just want everybody to be able to get access. You know, this company was started by pharmacists and pharmacy technicians who have been in this world for a long time. We're not tech people who came up with this idea, said, let's get this out. We are people who come from this world. So we just want patients to have better access. You
know, one question that surfaced when we were chatting about this, obviously you still need a doctor's prescription for this, for whether it be a refill or a new prescription. But with the focus that's so much on the opioid crisis right now, what's to stop somebody from simply saying to you, look, this is what I need, and just getting it through the mail, essentially?
So we actually don't carry opioids right now. But 9 out of 10 prescriptions are your generic prescriptions that are for the major disease states that people need help with, that are inexpensive baseline, like hypertension, diabetes, cholesterol. And so this is the bulk of our business. We actually don't do any opioids online.
All right. So, and you'll continue to add as you add in different states, add more medications?
We have over 6,000 drugs on the site that you can search, and we just want people to use this as a resource.
How much do you think then, based on the prices that you are charging right now, the markup is for most people when they go to their pharmacy to get their drugs?
Thousands.
A percentage?
Yes. I mean, we are looking at astronomical pricing when you get to the counter because there are so many people involved in the pricing of your medication and determining what you can and can't take based on your insurance.
Right. Well, it is an option that is out there. Thanks for joining us today.
Thank you so much.
It is